Leaks occur when there is an abnormal escape of CSF from the skull base. While some cases resolve with conservative management, others require surgical intervention. In certain situations, ventriculoperitoneal (VP) shunt placement is considered to manage elevated CSF pressure and prevent recurrence. Spontaneous CSF leaks occur without trauma or surgery, often linked to idiopathic intracranial hypertension (IH). A VP shunt helps lower CSF pressure and reduces the risk of persistent leaks. High-volume CSF leaks, which are large or persistent, increase the likelihood of recurrence. Managing CSF dynamics with a shunt may improve surgical outcomes. Elevated opening pressure greater than 20 cm H2O is often seen in IH and contributes to leaks. A VP shunt helps regulate pressure and prevents further damage. Obesity, with a BMI greater than 30 kilograms per square meter, is strongly associated with spontaneous CSF leaks and recurrence. Reducing intracranial pressure via a VP shunt is beneficial in select cases. Preoperative imaging showing additional skull-based defects, such as defects in the contralateral tegmen or anterior cranial base, suggests a higher risk of multiple leaks. VP shunt placement may be a preventive measure. Empty Sella Syndrome is a radiologic finding where the pituitary gland appears compressed, indicating chronically elevated CSF pressure. This can be a sign of IH, supporting the need for a VP shunt. Conditions affecting CSF absorption, such as meningitis, intracranial hemorrhage, or significant closed head injury, impair arachnoid granulations, leading to CSF buildup and potential leaks. VP shunt placement is not required for every CSF leak, but is a critical consideration in patients with persistent leaks and high CSF pressure. Proper patient selection and preoperative imaging are essential for optimal outcomes. Consultation with a neurosurgeon and otolaryngologist helps determine